Hi, my name is Christopher Ray, and I am currently working on my master's in social work at Grand Canyon University. And this is my topic 8 for SWK 545 for Dr. Andrea Henry: Connected Pathways Bridging Service Gaps in Homelessness among Minority Populations. The community problem: minority groups face disproportionate homelessness due to systematic inequities. Gaps exist in affordable housing access and data integration between agencies. There's lack of coordination leads to duplicated services and missed opportunities. Community needs a centralized, culturally responsive, technology based solution. Connected pathways. In order to do this, it's essential to have a digital case management and coordination system connecting local shelters, health agencies, and social workers. This is going to be designed to bridge service gaps through technology and collaboration. I think we could work more effectively together if this were in place. These connected pathways prioritizes ethical, secure, and culturally informed data sharing. The description of the intervention is uses Ecovia Case Management. It's a software that is designed for secure client tracking. It facilitates real-time communication among housing and support agencies. This incorporates community feedback loops to ensure cultural responsiveness. This is according to Netting and others for successful macro level evaluations that should be intentional, systematic. I need my glasses. And outcome driven. This integrates data on housing, employment, and healthcare for holistic support. The goals: this is to enhance service coordination and accessibility through ethical, efficient technology use. This will promote equitable housing outcomes by identifying and addressing systemic disparities. The, the objectives are to implement Okavia software for client data and referral tracking. The development and ethical technology policy includes informed consent, encryption, and staff tracking. Another objective would be to create a technology ethics review committee to ensure compliance and ongoing monitoring. If we don't have people following up on this, then we're not going to know if these objectives are being successful or not. Our target population would be minority individuals and families experiencing homelessness. We need to focus on urban communities who live in Illinois. We would like to address barriers such as language, discrimination, and limited housing access. This comes from the National Alliance to End Homelessness. Another target population would be to ensure interventions that are culturally competent and inclusive. Key components and activities. This would be digital integration across housing, healthcare, and employment systems. Community feedback workshops to refine services. Staff training in cultural humility and ethical technology use. Monthly interagency case review meetings. The required resources: staffing, program manager, IT specialist, social workers, outreach coordinators, and data analysts. As far as the funding goes, who would fund this would be the HUD grants or HUD grants, the local government support, and philanthropic donations. For where I currently am doing my internship, we rely a lot on local funding, like donations. This last week, they did a spaghetti pickup for a local restaurant. I think it was like $15 or $25 for like a whole gallon of spaghetti, and we raised thousands of dollars. It was local grassroots seem to do really well, especially given their delivery. The materials would be the software licenses, encrypted devices, training materials, and outreach resources. Supervision and consultation. Supervision needs to be led by LCSW and Technology Compliance Officer. Focus on ethical decision making and professional judgment. Peer consultation to promote collaboration and problem solving. Continuous review of client progress and system integrity. Evaluation helps highlight program strengths, identify areas for improvement, and promote accountability, which netting and others identify as essential components of effective macro practice. The timeline. So they're going to have phase 1 through 4, and in phase 1, that's going to be 1 to 2 months. They need assessments to finalize the ethical policy. Phase 2, that's going to be months 3 and 4. The staff training and software implementation, which we all know anytime we get any new technology, it can be very difficult maneuvering, and that transition takes some time. Phase 3, this is going to be months 5 and 6, service delivery and data collection. Phase 4 are going to be months 9 through 12. It's going to be evaluation and improvements. I think on a lot of things like this, feedback is essential to the success. Outcomes and evaluation. The expected outcomes. 25% increase in housing placements for minority clients. Improve interagency coordination and reduce duplication. Higher client satisfaction and trust. The way we're going to measure this for the evaluation tools are quantitative housing retention data and service metrics. Qualitative is going to focus on groups, client interviews, and staff feedback. Ethical use of technology. We have to have that informed consent, and client privacy are central. Data encrypted and stored securely. Regular audits by the Ethics Review Committee, and transparent communication with clients about data usage. The conclusion. We're going to be using the connected pathways, which integrates innovation with empathy, strengthens partnerships, improves accountability, and promotes equity. A sustainable model for culturally responsive homelessness intervention. There's my references. Thank you for your time and listening.